The first sort of episode that I had was the day my son was born, which was 18 years ago. In the middle of the night, I actually woke up and I was completely numb down one side of my body from head to toe, and it suddenly sort of broke out in hives. But I noticed, like, as the weeks passed after I had my son, you know, you expect to be tired and exhausted and not feeling 100%. And I just felt like I wasn't starting to feel better. I was starting to feel worse. I developed a sort of really pounding heart rate in bed at night, so loud that I could not fall asleep. This rash that I had initially developed didn't go away. Then I started getting sort of these dizzy spells, maybe 4 or 5 times a day. It actually took 4 years to diagnose me with systemic mastocytosis. Finding it and confirming it is not easy either, because it's based on skin biopsy, bone marrow biopsy, tryptase levels in your blood. It's not something I inherited. It's just something, like many cancers, a switch just turned on. I was on the Gleevec for 10 years, and it worked really well for me in terms of subduing the worst of the mastocytosis symptoms. 2 years ago, just out of the blue, for reasons that are unknown, the Gleevec stopped working.
Dawn was beginning to develop severe bone pains from expansion of the cancer in her bone marrow. She was becoming so anemic that she was requiring regular, repeated blood transfusions. Her white count and her platelet count were dropping, which are things that put her at risk.
Dr. Grossman is an amazing physician, and his character is that if there's a puzzle, he wants to solve it. He wanted to see if there was another option, a better option.
There had been a recent small study done of a promising new drug that examined just this patient population with promising results. So at the recommendation of the lead researcher on the study at Stanford University, I reached out directly to the pharmaceutical company, both at their headquarters here in the United States and in Europe, to see if there would be some way to get use of the drug on what we call a compassionate use basis for a single patient who has an urgent need. We were able to arrange for Dawn to have the medication within a matter of 2 to 3 months. And that's a real sort of testimony to the resources that Memorial was willing and able to put at our disposal.
What was amazing was how quickly it started working immediately. We were seeing, for the first time in 18 years, my tryptase levels coming down and my histamine levels coming down when they had not budged. The heartbeat issue disappeared. I was able to stop taking the high-dose antihistamines, which I'd been taking for 18 years. This trial, I honestly feel, has given me my life back, and it's given me a second chance.